the blocks, the wax blocks, and I simply place them in position on the base of the block bite. We have to be careful when we do that. It has to be very well welded, so to say, to the base. Obviously it's not a welding, it's just melting wax there, but in these situations, which are the terminal part of the ridge, the bite block will be oblique in the distal zone to avoid premature contact with the mandible, with the ramus of the mandible, right? So while the wax is still hot, you can determine the exact position. The height, it has to be like 2 millimeters higher than the remaining teeth. The width, similar to the occlusal surface of the teeth where it stands. So in our case, the width of a molar. Right? It replaces, it's in the place of the molar, so it should have the width of the occlusal surface of a molar. The block in the frontal region has to be placed on the curvature of the arch. As you can see, it mimics the shape. It has to be in the same position as the central incisors would have been. Central, lateral incisors. Just try to replace the teeth that it represents, so to say. So here we also have, this will also give us the, or indicate to us the future position of the upper lip when placed in the patient's mouth. On this one, the dentist will also mark the midline, the vertical, the smile line, and if canines are missing, the line of the canines corresponding to the wing of the nose and the buccal commissures. The lips commissures, the junction of the two lips, upper and lower. Again, it has to be very well fixed to the base. So this is the bite block. And if the antagonist arch is edentulous, we do the same, you see, for the mandible. So those will be sent to the clinic and the dental office to record the relationship in the patient's mouth, and then according to that they will be mounted in the articulator in the lab.